Minister of Health Prof Adewole has said quality of healthcare should be seen as fundamental human right to which every Nigerian is entitled. Adewole said this at the launch of a checklist for assessing the quality of service in the federal tertiary health institutions and the National Surgical, Obstetrics, Anesthesia and Nursing Plan.
We should see quality as a fundamental human right, not just as a tool, not as a system, not as what we call a collective, not as a process, but we should see it as a right to which every Nigerian is entitled to enjoy. And if we have that in mind, I think we will change the way and manner in which you do business. The other thing has to be productivity. We must look at productivity. And lastly, the environment. And that is the real challenge for our CMDs, our chief executives. We must put things right. And we don't have a choice. The searchlight is on us. And it's even more serious simply because the secondary care system is underperforming. There is a huge demand on you. When we put all this together, we will have a health system that will serve us well. We cannot have a perfect checklist, but we must start from somewhere. And we'll continue to improve on it. And that is why this checklist has to be improved on, but let us start.
Professor Adewole Udofia, Registrar National Postgraduate Medical College of Nigeria, has recommended capacity building through training of personnel and specialists so as to strengthen healthcare system in the country.
The college has played and continues to play a role in training of manpower that will meet the objectives of the surgical, obstetric and anesthesia plan. Because without this trained, specialized manpower, the delivery or meeting the objectives of the SDGs and the plan of the federal government will not be realized. We are looking forward to the implementation of the residency training bill which has been signed, which will give a robust training to our specialists. So in all, the college continues to position itself and readily assist and to see that this National Surgical Obstetric and Anesthesia and Nursing Plan comes to fruition and places the health of the nation in a better footing.
For his part, the Acting Director General, Bureau of Public Service Reform, pled essentially for the full implementation of the checklist program. He also promised to follow the initiative, stating that the report will be submitted to the National Executive Council.
The problem with us is not initiatives, policies, or programs, but the problem is implementation. So we had all committed at the commencement of this program to see this to the successful implementation of this initiative. I hope we'll hold on to that. The Bureau of Public Service Reforms has the responsibility to monitor reforms initiated by us and all sectors of the federal public service. We'll be following this initiative, we'll be capturing it, and the reports will be submitted to the Federal Executive Council through the National Steering Committee on Public Service Reforms, which is chaired by the Secretary to the Government of the Federation.
The event also featured presentations by stakeholders in the healthcare sector.
We commissioned the documents in the name of God the Father, the Son, and the Holy Spirit. Thank you.
Thank you, Honorable